Hi, I'm Dr. David Brownstein. I'm a family practitioner from Michigan, and I've been practicing holistic medicine for over 20 years. In today's talk, I will discuss with you the prevalence of thyroid problems and why it's affecting so many Americans and what you can do about it. I will show you that up to 60 to 80% of Americans are currently suffering from an undiagnosed abnormal thyroid function. I will show you that thyroid dysfunction is the #1 cause of heart disease, and it's the major cause of arthritis, cancer, and many other chronic ailments that is not currently being diagnosed. I'd like to show you what undiagnosed hypothyroidism can do. This is Laura, and Laura's mom brought her to me because Laura was irritable and not playing, and she was cold in the summertime. And you can see in this picture that she's got these black shiners under her eyes. Her hair's sitting lifelessly on her head. And Laura's mom was being treated by me for hypothyroidism. Laura had normal thyroid blood tests. She had a low basal body temperature. She met every clinical sign to diagnose low thyroid. And I gave her a therapeutic trial of thyroid hormone. And here's the results in Laura, 6 months later. You can see she lost the allergic shiners under her eyes. Her hair became back to normal. And most importantly, she became more active and became her normal self again. I will show you during this talk that undiagnosed hypothyroidism can have serious consequences in people, not only from children to adults. And here's a picture of Laura today. This is my book, Overcoming Thyroid Disorders. It was one of the first books that I wrote many years ago, and it's currently in its 2nd edition. And I wrote this book because I started seeing so many patients with thyroid problems that were not being diagnosed by their doctors and patients suffering from this illness. My first patient was my father. My father suffered his first heart attack at age 40, his second heart attack at 42. My father had seen many doctors and had undergone 2 bypass surgeries and many angioplasties. He was on a whole host of medications by the time I'd finished medical school and my residency. And at that time, he truly looked like he was going to die. Now, I had learned in medical school that the way to diagnose thyroid problems was to take a blood test, and particularly a TSH blood test. And if that blood test was abnormal, then you give the patient a prescription for thyroid hormone. What I've learned now is a TSH test does not pick it up in many patients, and it certainly didn't pick it up in my father. And when I performed a holistic evaluation on him, I found that he was suffering from an undiagnosed thyroid problem. And I also learned that an undiagnosed thyroid problem could explain his chronic heart disease progression. When I treated my father for his thyroid problem, his 25-year history of angina went away in 7 days, never to return. He looked better, he acted better, he lost 20 pounds of weight without changing his diet and his habits, and more importantly, he didn't look like he was going to die. And really, that was my first patient, and that set me on my quest to diagnose and treat and to educate people about thyroid problems and what they can do about thyroid problems in their lives. I'd like to start off with a quote. The superior physician helps before the early budding of the disease. The inferior physician begins to help when the disease is already developed. This quote was written thousands of years ago, and it really speaks to the heart of holistic medicine. In conventional medicine, when I was taught in medical school, was to diagnose pathology and to use a drug to treat that pathology. But by the time you diagnose the pathology, the disease is already there. What I try and do in holistic medicine is to recognize the signs of dysfunction in the body and to treat that before pathology develops. And that's what we'll talk about today, particularly with thyroid problems. Now, this is my collection of books that I've written. I've written 9 books so far, and we're going to focus on overcoming thyroid disorders today. Now, this quote was written 35 years ago, and it was from one of my mentors in thyroid problems, Dr. Brodo Barnes. And he wrote that 40% of American people, 4 out of every 10 children and adults today, are suffering needlessly, and many are dying from lack of an ingredient vital for health. Is the ingredient unknown? No. Or unavailable? No. For years, medicine has recognized the role of the deficiency in some areas of health and disease and has had clues to its great importance in many other areas. But the knowledge has often not been used and still is not being used because of the unreliability of laboratory tests that have failed to show the deficiency, even when doctors could see its manifestations clearly enough in patients before them. And while lab tests have erred and have misled both doctors and patients have suffered. Unfortunately, this quote is still true today, 35 years later. Doctors are still misdiagnosing thyroid problems or not diagnosing thyroid problems because they're relying on unreliable lab tests. These are the chapters in my book that we'll talk about today, and we will cover these disorders, and I will give you practical tips on how you can help improve a thyroid problem. We'll focus on hypothyroidism, and you need to know that thyroid hormone affects every cell in the body, and that you can't achieve your optimal health without a properly functioning thyroid gland. And I believe hypothyroidism, or an underactive thyroid, is the most commonly misdiagnosis today, and upwards of 60 to maybe 80% of the population may have an undiagnosed abnormal thyroid problem and may have undiagnosed hypothyroidism. The way I describe it to my patients is that every cell in the body has a little machine in it, and that machine is driven by thyroid hormone. And you can visualize that like a piston turning. When there's enough thyroid hormone, that piston turns at the appropriate rate and gives off enough heat, and people feel good and have enough energy. When there's not enough thyroid hormone, that piston is very sluggish. People are cold, they're tired, they're gaining weight, they have dry skin, headaches, migraine headaches. We'll talk about all that during this talk. So this is the pathway we'll talk about. The thyroid gland sits in the lower part of the neck. It weighs about 1.5 ounces and produces a teaspoon of thyroid hormone for a whole year. This teaspoon of thyroid hormone has to drive the metabolic rate of every single cell in the body 24 hours a day, 7 days a week. When I lecture to physicians, this is the pathway that I discuss with them. And the thyroid gland releases a hormone called T4. T4 goes into the bloodstream and gets converted to T3 inside the cells of the body. And T3 is what has the effects on the body. It's what drives those pistons. It's what gives people energy, heat, and makes them feel better. This is the pathway we want to optimize. Now, when the thyroid gland gets out of balance, it pulls all the other endocrine glands out of balance. And these are a list of who's who, of who's not feeling well out there when the hormonal system is imbalanced. You can have allergies and anxiety and arthritis and cancer, candida, chronic fatigue, fibromyalgia. I won't go through this whole list, and we'll cover most of this during the talk. But needless to say, every cell in the body is not going to function normally if there's not enough thyroid hormone. Now, this study is called the Colorado Thyroid Disease Prevalence Study, and what the authors of this study did was to put a booth at the Colorado State Fair, and they drew the blood from 25,000 subjects. They didn't do a history, they didn't do a physical exam, they just drew the blood, and they looked at thyroid hormone levels. And what they found were that 10% of the people studied were found to have an undiagnosed abnormal thyroid function. When they extrapolated these numbers out nationally, now remember these were adults, they estimated that 13 million adults nationally may have an undiagnosed abnormal thyroid function. Now, I say those numbers are fine if you're just going to rely on the blood tests, but once you do an appropriate physical examination, once you do a history, and once you check basal body temperatures, which I will explain as we go through this talk, you will find the numbers are probably 50 million and higher have an undiagnosed abnormal thyroid function. I believe it's an epidemic disease that's being undiagnosed and untreated. So one of the consequences of undiagnosed hypothyroidism is atherosclerosis. The relationship between low thyroid and atherosclerosis has been written about since the late 19th century. Unfortunately, most physicians don't recognize that. In this study, 2,550 subjects were looked at, and they found a subclinical hypothyroid picture. This is a slightly low thyroid production, was associated with a 260% increase in the prevalence of heart disease. Now, it's my belief that cardiologists should investigate thyroid function first in someone who presents to them with heart disease versus just looking at their cholesterol levels. In this study, 97 subjects with subclinical hypothyroidism were looked at. They had slightly elevated TSH, and they had 20 years of follow-up. And the authors found that subclinical hypothyroidism was associated with a 76% increase in heart disease, and it was also associated with a 79% increase in mortality from heart disease. And when subclinical hypothyroid patients were treated with thyroid hormone, there was no difference seen between subjects and controls. Again, this was the same result that I found with my father. Once we corrected his undiagnosed thyroid function, his heart disease went away. And I've seen this same case occur over and over in my practice over the last 20 years. This was an article from Family Practice News, subclinical hypothyroidism tied to cardiac risk, trying to educate physicians about this. My experience has been most conventional physicians have no interest or knowledge in how to properly diagnose a thyroid problem. And again, I will educate you on ways that you can go about doing this. Now, this was a very interesting study, and where they looked, it was a 35-year study, and they looked at thousands of participants, and they looked at the risk of heart disease as it related to TSH levels. And what you can see is the TSH levels were mildly increased. There was a neutral risk of heart disease, but as it went up just above the normal range, from 7.8 to 9.9, there was a 17% increase of heart disease, and when it went higher than that, there was almost a 90% increase. But the risk of mortality was increased even near normal levels of TSH, a 9% increase. And as it went up to 42% and 58%. And again, this points out that for anyone with any history of heart disease or family history of heart disease, one of the first things to look at is the thyroid gland and to ascertain if there's normal thyroid function going on. We know that TSH receptors are expressed on coronary arteries and fat cells, and that an elevated TSH can directly affect the endothelial function of coronary arteries or fat cells. This can induce ischemic heart disease when hypothyroidism is present. What this is saying is that a slightly elevated TSH can cause spasm in the coronary arteries and cause people to get chest pain. Now, it's not only heart disease related to hypothyroidism. Things like inflammatory bowel disease can also occur with low thyroid disease. We know that small bacterial overgrowth is diagnosed by a lactulose blood test has been found in 54% of hypothyroid patients, and it occurred even when patients were treated and were normal thyroid. What that means is these low thyroid patients are developing abnormal bowel overgrowth of bacteria, and if they're treated early enough, this probably wouldn't occur, but when this goes on a long time, they're going to need other holistic therapies like acidophilus. Now, the thyroid gland also is responsible for neural development or normal brain function. 169 participants were looked at in this study, and 53 children of mothers with hypothyroidism were treated with levothyroxine, which is either Synthroid or Levothyroid, shortly before or during pregnancy, and they monitored the TSH, and they were compared against the control group. And they were evaluated at various times for neuropsychological evaluation. In infancy, the children of the hypothyroid mothers were found to have abnormal visual processing, deficits in attention, as well as sensory motor skills and memory. At age 5, the mean IQ was 8 points lower in the children of the hypothyroid mothers, and they also had lower scores in tests of working memory, as well as verbal and associative learning. Now, we're all aware of this epidemic of ADD that's prevalent in our schools today that wasn't prevalent 20 to 30 years ago. And I say this prevalence of ADD is in part due to an abnormal endocrine functioning, including hypothyroidism. Now, it's important to treat this hypothyroid problem before the woman becomes pregnant. The thyroid glands forms in the first trimester of pregnancy. If the mom is giving the baby enough thyroid hormone during that first trimester, the baby's thyroid gland can develop normally. It's very important to ascertain a mother's status of thyroid before she becomes pregnant. Now, if we think about how many children are suffering from ADD now and this epidemic of ADD that's occurring in our schools, I say that one of the main reasons is an abnormal thyroid function. It's very important for mothers to get their thyroid level ascertained before they're pregnant. The baby's thyroid gland forms in the first trimester of pregnancy, and if the mother is supplying normal thyroid levels to the baby should develop a normal thyroid gland. However, if the mother is having hypothyroid symptoms and not supplying enough thyroid hormone to the baby's thyroid during that first trimester, eventually the infant is going to display signs of hypothyroidism, which in this case can be symptoms of ADD. Now, this will also make the same point with in the importance of treating thyroid problems before the mother becomes pregnant with the baby. In this study, the children of mothers with untreated hypothyroidism were looked at versus mothers without hypothyroidism. The IQ scores were 7 points lower in the children of the untreated mothers, and 19% of the untreated mothers had children with an IQ of less than 85 compared to 5% of the others. Now, an IQ of less than 85 is a child who will not go to college, a child who will be in trouble in school, and particularly in high school, and may not graduate from high school, and will be a problem for society. These are all preventable problems if the mother has adequate thyroid hormone before the pregnancy. 220 children were looked at, a neurodevelopmental assessment at 10 months. The 22 children of mothers having the lowest T4, that's thyroid hormone, at 12 weeks gestation scored significantly worse on a psychomotor developmental index as compared with the others. Now, it's not only ADD and neurologic problems and heart disease occurs with thyroid disease, it's also cancer. We know hypothyroidism or an underactive thyroid has been associated with cancer of the breast, including autoimmune thyroiditis and hypothyroidism, stomach cancer, pancreas cancer, as well as colon cancer. And the use of thyroid hormone is associated with a 41% reduced risk of colorectal cancer. So again, it's very important to diagnose this early and to treat it early. Now, there's an increased risk of spontaneous abortion in women with hypothyroidism or thyroid antibodies, and there's a 200% increased risk of preterm delivery in those women that had hypothyroidism. This is my mentor from learning about thyroid disease, and his name is Dr. Brodo Barnes, and he wrote a book in the 1970s titled Hypothyroidism, the Unsuspected Illness. And Dr. Barnes wrote that book to describe his 40-year history of treating thyroid patients, where he felt the commonly used blood tests available to him at that time were missing most people with hypothyroidism. And unfortunately, the same thing is occurring today, 35 years later. So, if I say the blood tests don't pick it up, how do I do it? Well, one of the first things I do is take a history on patients. And these are some of the things that I look for on a history. I look for if a patient is suffering from acne or any arthritic condition, atherosclerosis, constipation, if they had cold extremities, cold hands and cold feet, if they have decreased hearing, depression, eczema, fatigue, particularly morning fatigue, if they suffer from headaches or migraine headaches, hypercholesterol or high cholesterol, hypertension or hypotension can be related to low thyroid. Infertility is particularly related to low thyroid function. I've treated many patients over the years for infertility issues, and it's solely related to low thyroid function. Julie is a patient of mine, and Julie came to me complaining that she was tired and cold, and she was having headaches, and she wasn't thinking clearly, and she was 30 years old, but her big problem was she was infertile, and she couldn't get pregnant. She had gone through GIFT and ZIFT and spent thousands of dollars trying to get pregnant, and when I saw her, she met every criteria to diagnose low thyroid, except her blood test was normal. Her basal body temperatures, which I'll discuss with you in a minute, were very low, showing a low thyroid function. And when I treated her with a small amount of thyroid hormone, not only did her hypothyroid symptoms get better, but she magically got pregnant 2 months later. And to this point, Julie is still taking her thyroid hormone, and I've treated many patients like Julie over the years. Mental impairment, menstrual disorders such as heavy bleeding and bad PMS symptoms can be related to low thyroid. Ovarian cysts can be related to low thyroid. Poor memory, psoriasis, recurrent infections, slowed movements, and voice changes can be related to low thyroid. These are all the signs that I look for on my patients when I take a history from them. Now, not only do I do a history, I do what I was taught in medical school. You do a physical exam. And these are some of the things on physical exam that I look for my patients. Are they anemic? Do they have dry skin? Do they have swelling? Particularly swelling under the eyes, and I'll show you some slides of some patients that have that. Do they have a goiter or swelling of the thyroid in the neck? Do they have hair loss, particularly hair loss in the front of the head? Do they have hypertension or hypotension? Macroglossia means a swollen tongue. I'll show you a picture of a swollen tongue. Do they have periorbital edema, which is swelling under the eyes? Poor eyebrow growth, especially the outer third of the eyebrows, fades away. It's known as the sign of Hertog, and that was written about in the late 1800s. It's related to low thyroid. Do they have a puffy face in general? And they can have sluggish reflexes. These are all the physical exam signs that I look for on a patient that I might suspect has low thyroid. But also, I will look for their tongue swelling. And here's a picture of a patient with their tongue swelling. And what you can see is on the outer edges of the tongue, there's little grooves in that where the tongue is banging into the teeth because it's too big for the mouth. Many times patients will tell me that their tongue feels too big for their mouth and they're tripping over it as they're trying to talk. All this goes away when you treat them appropriately with thyroid hormone. Now, this was an interesting study that found that the biggest difference between thyroid and non-thyroid patients were ankle reflex being slow, slow reflexes, dry skin, coarse skin, puffiness, constipation, and slow movements. These were the major differences between people who had thyroid problems and people who didn't have thyroid problems. And these are what I look for in my patients. Now, I also do lab tests. I mentioned to you that I didn't think the lab tests were the most appropriate way to diagnose someone with a thyroid problem, but they should be part of a diagnosis paradigm. So I check TSH, I check T4 levels, I check T3 levels, I check reverse T3 levels, and I check thyroid antibody levels. I also do 24-hour urine testing occasionally. Every thyroid patient deserves a serum ferritin level, which measures the iron level in the body, and they deserve a serum B12 level. And you can put the whole picture together better by doing more than just a TSH test. I get accused from my conventional colleagues that you should just check a TSH level and that should be able to diagnose a thyroid problem, and the answer should be yes or no, and that's just not true. And in the peer-reviewed literature, there are many studies like this one that I'm quoting to you, where it states that thyroid function tests cannot be interpreted in a vacuum. Non-thyroidal disease and certain drugs affect these tests. A suppressed TSH in a critically ill patient might indicate a sick euthyroid syndrome. The decision to treat should be individualized. There is no sense in waiting 3 years to treat a patient with a persistent TSH greater than 5 if the patient is clearly symptomatic, TPO titer is elevated, and a goiter is present. In summary, we should discard rigid guidelines that are driven mainly by cost containment. And I couldn't agree with this quote anymore. And there are many studies that point out that we are treating patients and not just TSH tests. Now, I've been telling you that the diagnosis of hypothyroidism is much more than a TSH test. You need to take a history, you need to do a physical exam, and you need to do other blood tests. But one of the crucial monitors for thyroid function is the basal body temperature. The basal body temperature is the first morning temperature that your body has while you're lying in bed before you get up. The way you do it is on this slide. You can have a thermometer at your bedside and put it under your arm or in your mouth if you don't have a cold or a flu symptom. And you take the morning temperature. Menstruating women should take their temperature on days 2 to 4 of their cycle. And a normal underarm temperature is 97.8 to 98.2 degrees Fahrenheit. And a normal oral temperature is a degree higher than that, 98.8 to 99.2 degrees. A lower temperature would signify that those pistons are not running normally and giving off heat, and people's bodies are cold, and would signify a low thyroid function. I have many of my patients take basal body temperatures on a routine basis and bring them into me, and I use that as part of my diagnostic capabilities. A holistic way to diagnose a problem that can affect every single cell in the body from head to toe is take a history, looking for the signs of thyroid illness, do an appropriate physical exam, check basal body temperatures, and do the appropriate blood tests, and put the whole picture together. It's much more than just spending 5 minutes with someone and checking a TSH level. Now, this quote was written in the 1930s, and it was by Dr. Henry Harrower. And he said, "Are not the feelings of the patients often as clinically valuable as the other findings? In no case can we wholly discount them. A good laboratory report is cold comfort to a patient whose symptoms remain unchanged, and the doctor can repeat such reports until he's blue in the face, but they will not help his patient much if unaccompanied by controlled symptoms and changed feelings. The successful physician is the one who knows best how to make his patients feel better." We should have heeded Dr. Harrower's advice from 80 years ago, and we wouldn't be in the problem we're in right now in medicine, and we'd be treating patients instead of blood tests. Now, the problem with just treating TSH tests is you can let low thyroid disease go on, and patients aren't being treated, and eventually they can develop serious illnesses like thyroid cancer, which is occurring at epidemic rates right now. In this study, 50 euthyroid subjects underwent thyroidectomy. 1/3 were found to have thyroid cancer when they weren't expecting to have thyroid cancer. And if you look at these numbers, a higher mean TSH from 1 to 5, now this is in a normal range as compared to those with benign disease, which is around 1. There was an 8.7-fold increase of thyroid cancer in the subjects with a TSH in the upper third quartiles of TSH values, from 1.2 to 3.7, which is still in the normal range, compared to those with the lowest quartile, from 0.5 to 1.1. And T3 levels in those diagnosed with thyroid cancer, as compared with those with a benign disease, were also found to be elevated. Again, these were all in the normal thyroid range. What this points out is the normal thyroid range is not normal for everybody, and everyone needs to be individualized. When you follow this holistic approach that I'm outlining, you will pick up thyroid disease much earlier. Now, reverse T3 can also be a problem, and I check reverse T3 levels in every one of my patients. And if reverse T3 levels are elevated, that can signify that the liver needs to undergo a detoxification. And there's a product that I designed called Total Liver Care that can help that liver detoxify and allow reverse T3 levels to decline. And sometimes in this case, instead of using Synthroid or Levothyroid, you use T3 preparations or desiccated thyroid preparations like Nature Thyroid. Now, the British Medical Journal, they state the biological effects of thyroid hormones at the peripheral tissues and not TSH concentrations reflect the clinical severity of hypothyroidism. A judicious initiation of thyroid hormone treatment should be guided by clinical and metabolic presentation and thyroid hormone concentrations and not by serum TSH concentrations. If you're hearing from your doctor that your thyroid's normal, yet you have every sign and symptom to meet the diagnosis of low thyroid, and they're just checking a TSH level, my suggestion to you is to find another doctor that's going to look at you as more than just a TSH level. Here's another quote from the peer-reviewed literature. "We should acknowledge that TSH is not a good indicator of the adequacy of thyroid replacement. We should prescribe sufficient thyroxine to restore the patient to clinical euthyroid state while maintaining T3 within the reference range." What they're saying is don't just rely on a TSH level. Now, prior to the TSH levels, doctors would treat patients clinically. They would do a history, they would do a physical exam, and they would make a clinical decision whether they thought they had a thyroid problem. And their standard thyroxine replacement doses range from 200 to 300 micrograms per day. That's the same thing as Synthroid or Levothyroid. In 1971, there was a first report on the measurement of TSH tests in a patient on thyroxine replacement. And from that point on, doctors primarily began using the TSH test solely. Now, they reported that the serum TSH returned to normal with 100 to 150 micrograms per day of thyroxine. This was an immediate 50% reduction in dosage. So as soon as we started relying on the TSH to diagnose someone as having a thyroid problem or not, we reduced the amount of thyroid hormone we were giving to patients by half. And I think the consequences of that now are ongoing atherosclerosis as the number one killer, cancer, arthritis, and a whole host of other chronic illnesses related to low thyroid function. 9,403 women were looked at. They looked